Hello and welcome to Drugs Plus. Whether you're here for exam revision or just general interest, I hope you find this video useful. If you do, please give it a thumbs up and subscribe to support this channel so that I'm able to continue creating this content. In this video, I'm going to give a brief overview of the pharmacology behind the treatments for schizophrenia. Before watching this video, I highly recommend watching my video on the pathophysiology of schizophrenia, as this will give you the grounding with which to understand the rest of the video. First, I'm going to discuss the original treatments for schizophrenia, the so-called typical antipsychotics. These drugs are dopamine D2 receptor antagonists. This prevents the effects of the schizophrenic hyperfunctioning mesolimbic dopaminergic neurons, reducing dopamine levels in the limbic system. However, these drugs only, therefore, relieve the positive symptoms of the disease, as discussed in the previous video. Drugs of this class include haloperidol, fluphenazine, and chlorpromazine. One issue with these drugs is that D2 receptor blockade in the tuberoinfundibular pathway causes an increase in prolactin secretion, which can induce gynecomastia. Additionally, D2 blockade in the nigrostriatal pathway can cause extrapyramidal side effects similar to those seen in Parkinson's disease. However, the main downside of these drugs is that they have no effect on the negative or cognitive symptoms. The next class of drug to be developed were the atypical antipsychotics, also known as the second generation antipsychotics. These drugs do block D2 receptors, but actually have the highest affinity for D4 receptors. This makes these drugs superior to the typical antipsychotics, as D4 receptors are not expressed on the tuberoinfundibular pathway or nigrostriatal pathways, reducing the side effects. These drugs include olanzapine and Risperidone, and still have no effect on negative or cognitive symptoms. One upcoming type of therapy, however, aims to tackle this. Glutamate therapies aim to treat the cause of dopaminergic dysfunction rather than trying to reverse it. One such class of drug, GLY1 inhibitors, act to remedy the NMDA receptor hypofunction observed in schizophrenia. At the synapse, much of the glutamate is taken up by microglia via GLY1 transporters. Therefore, by blocking these transporters using inhibitors, the volume of glutamate that is available to activate NMDA receptors is increased. Glycine site agonists are also being trialled to remedy NMDA hypofunction, as these receptors need both glutamate and glycine to become activated. Thank you for watching this video. If you found it useful, please give it a thumbs up and subscribe to support this channel so I'm able to continue creating this content. I'll be back with more pharmacology videos soon.